Hello, good afternoon, ladies and gentlemen. I am Dr. Mumuing, obstetrician and gynecologist, greeting from Royal Phnom Penh Hospital. I'm going to share my knowledge, postpartum. What is the postpartum? It's a time immediately after childbirth to mother's body returns to non-pregnant state. Postpartum periods, body change after delivery. So we need to monitor their vital signs, level of their consciousness, blood pressure, heart rate, respiration, and temperatures. And then we need to check their abdominal examinations. After baby birth, we need to deliver their placenta and check their uterus is whether well contracted or not. If the uterus is soft, there is a risk of the postpartum hemorrhage. So if we need to do the uterine massage. So we need to check the uterus is go down after delivery of the placenta at the level of the umbilicus or 1 finger breadth below the umbilical regions. Uterus evolution occur every day, 1 centimeter per day, and then non-pregnant stage go down at 6 weeks of the following vaginal delivery or cesarean section. And then we need to check the vaginal bleeding, why the amount of the blood loss we need to estimate, and why the patient has sometimes massive bleeding. It can happen for those women who has the twins pregnancy or large baby, or mother has the fibroid. For those women, prolonged labor or precipitate labor, for those people is a lot of blood loss. We need to use the uterodonic medicine. And why the other causes of the vaginal bleeding, we need to check the vaginal delivery cases, episiotomy wound, there is a massive bleeding or not, whether there is a swelling or hematoma, we need to check it. Yeah. Abdominal is a cesarean section cases, we need to check the surgical wound, whether there is a oozing of the blood in the wounds, whether they have the pain or not. Every day we need to check it. Immediate breastfeeding is we encourage because there is a colostrum secretion, and this colostrum contains an antibody. This antibody prevent infection of the chest for the baby, skin infection, and GI problem. If mommy give the breastfeeding, there is a less chance of the postpartum hemorrhage, and later life they have the less chance of the breast cancer, ovarian cancer, and fat spacing as well. Patient is stay in hospital or after going home, we need to check abnormal symptoms. Nowadays, COVID periods, they have the hoarseness of the voice, fever, coughing, sore throat, or flu infections, the chills and rigors. Other causes we need to consider mostly is the breast engorgement, mastitis. So especially for the primary gravidator baby, mother didn't know how to give the breastfeeding. So we need to teach them how to hold the baby attachment position of the breastfeeding before they go home to prevent for these complications. If untreated for breast engorgement, there might be breast abscess formation and surgical operation is necessary. Other causes are urinary tract infection, very common for after delivery of the mother. Sometimes they have the episiotomy wound and very painful, they cannot walk and they cannot pass urine. So we need to check their urine examinations. The last thing is mother may have the emotional change. Sometimes, very rarely, they may have the puerperal psychosis or puerperal flu. So family supports and is very necessary. Not only the husband and parents and sisters who have the experience for their childbirth, and then mommy should have the enough sleeping hours and reduce the anxiety, and baby should be taken care by other relatives person. So if the patient go home and they notice that, look here, is first is red color, and later is color will change, pink color and white color, and later is no more discharge from 6 weeks of the postpartum periods. If the lochia is bad smell, they need to discuss with the consult with the doctor why this one was happening. And sometimes endometritis cause the foul spending discharge. The last thing is after delivery, especially for the vaginal delivery cases, they need to do the Kegel exercise, pelvic floor muscle exercise to prevent for the urinary incontinence. I would like to remind to do this exercise after delivery. 1 week after delivery, they can do as long as possible to prevent for the urinary incontinence in later life.